Thank you for joining us for Trust Building in the Black Community, Trust in Untrusting Times. Good evening. I am Dr. Carrie Register Haley, and I will be your moderator for tonight. This evening's event is the last in this three-part series of virtual community discussions that was intended to shift the narrative around mistrust while exploring the relationship of trust in the Black community on a variety of systems. We have dug deep into conversations about attitudes, beliefs, and values that shape or influence our belief system in our decision-making process when it comes to healthcare, mental health, public service, or public safety, education, and child welfare. Tonight, though, we will be digging deep into the conversation with professionals in the mental health community, medical services, and law enforcement. But before I introduce our panelists, I'd like to go over a couple of housekeeping notes. Now, first, I'd like to inform you that tonight's event is going to be recorded. And so if you want to take your screen name off, or if you want to remove any identifiable information, please do so now. Now, you could have the option of leaving your screen up so that we can see your bright and shiny faces so that we can really engage in this conversation, or you can have your camera off. Also, if you go up into the right-hand corner, there's a speaker's view. If you click on that, you will only be able to see the person who is speaking currently. But if you leave it on gallery view, you will be able to see everyone who is in the session. Now, also, we have a chat feature at the bottom. So if you scroll along the bottom, you see the chat, you can click there, and that's where you can either put your comments or your questions there. And just as a reminder, we will be doing a lot of polling questions tonight. And so if you can't see the polling questions, I will be reading them off and the options. And then you can just place that in the chat box along with your comment about the question that we just asked. At the end of this event, we will have several resources that we will be providing you with, along with some takeaways from tonight's event. And don't worry, if you don't get an opportunity to pull them down, they will be sent along with a survey. The survey will take you about 5 minutes to complete. We ask that everyone complete the survey because it will be helpful to us as we continue to plan different events in the future. And just as a reminder, I want to go back to the polling questions. When we do the polling questions, as a reminder, they are anonymous. So it won't be tied back to anyone and your privacy will be maintained. Now that we've gotten the housekeeping out of the way, I want to again introduce myself. I am Carrie Register Haley, and I am the current Health Chair Committee for the Northern Virginia chapter of the National Coalition of 100 Black Women. Joining us tonight on the panel, we have Daryl Washington, who is the Executive Director, Fairfax Falls Church Community Services Board. We also have Dr. Quentin Lucas, who is the CEO of Quintessential Doc Family Medicine and Clinical Informatics, Family Medicine and Clinical Informatics. And then we also have Captain Daryl Nichols, who is the Equity Lead for Fairfax County Police Department. So welcome to our panelists. And as we go into this evening, we ask that you please ask all the questions that you need to get the answers from the right resources, and we have them on our panel. So we're going to kick off this evening by asking our panelists, starting with Mr. Washington, to give us 1 to 3 minutes and tell us, number one, why you do the work that you do in the community, and number two, tell us about what either your definition of trust or how you maintain trust in the community. So over to you, Mr. Washington.
Well, thank you, and good evening, everyone. So, I've been a long-term employee of the Community Services Board, probably about 25, 26 years. And I've always had, for the longest time, a significant interest in mental health and substance use issues primarily. And I'm a Native person that grew up in Fairfax and feel passionate about this work because being from this area and growing up here, I've actually had family members and or friends that have touched all three disability areas here at the Community Services Board. So it's something that's a professional interest, but also very personal to me as a professional. When it comes to trust, just at a very basic level, I found that, if you want to build trust, you have to say what you mean and mean what you say, and honor your word and keep your word. And I also don't see trust as a all one way or all the other way type of issue. I think trust is built over time and built through relationship building. And I think it's one of those things where, if you have a group of individuals or even one individual that's not trusting, you have to take additional steps to reach out to that person. And you might have to go 2 or 3 steps in order for that person to take a half step towards you. Hey, Dr. Haley, you're on mute. I can't hear you. Sorry.
Thank you so much for telling me that. I said I like that because what I heard you say is trust is a partnership. You build it from both ends. Thank you for that. Dr. Lucas?
Yes. For me, the work that I do really goes back to when I was about 3 or 4 years old, when I first decided that I was going to become a medical doctor. And thankfully, I had parents who were both supportive of that idea and just told me, just go ahead and you can do it. And really, I'm an introvert, so I listen. I listen to my family members and relatives talk about their experiences with healthcare. And some of them were good, but some of them were real horror stories. So I recall, my great aunt, my grandmother's sister, being pregnant with twins in the 1950s, and she knew that there was a problem and she sought out medical attention. And they basically told her, you may as well go home and die. So those were the sorts of things that I internalized. And I said, okay, well, I'm going to become a doctor. I'm going to take care of my family and take care of my community and the whole world. So that's how I started out on that trek. Now, obviously, as you grow older, you realize the magnitude of that and kind of what some of those limitations are. But I'm thankful to be in a position where I can start to affect change in those areas. And trust also for me, like Daryl mentioned, it's a two-way street. And I think it's about being seen. So I see you and you see me, both directly. I don't just see you as, diabetes or hypertension or high blood pressure. I see the whole picture. And I'm reminded, I had a patient a few years ago at the health department who came in complaining of constipation. And she just mentioned, my first question is always, well, how much water do you drink? Mm-hmm. And she said, well, I don't like drinking water. Now, your immediate response might be, well, why does this able-bodied woman who's perfectly capable not want to drink water? But rather than making assumptions, if you ask another question about why that is, she could tell you that, well, when I was leaving Central America, I saw dead bodies floating in water. So every time I see water, that gets triggered for me. That's a whole different approach. So if I'm able to see the bigger picture, we can ask the right questions, get them connected to the appropriate resources. And you can't do that if you're not seeing the whole person. So that's a big piece of it for me.
Wow. Thank you for sharing that. Captain Nichols?
The why is not about the money. For me, years ago when I was young, I didn't want to be a police officer. And I went through that period of time where I was like, forget the police, until I went to school and began to study. And I changed my major from business to administration of justice. And I have family in law enforcement. And I've always seen law enforcement in a different light. I've always been around law enforcement. So I'm no different than anyone else. I've had my trust issues with law enforcement, but it's not about the money. I want to see change in my profession, particularly my department. And that's why I'm here and I do the things that I do. And trust, to me, trust is a process. It is something that is built over time, like everyone else just mentioned. It is very easy to lose. And when you lose it, you have to work 3 times as hard to gain it back. It is not an overnight process. And it is that. It's just a process that is built over time.
Wow. you've all shedded some really good light on about how you got to this point. And I like the differences in your approach to trust, but it all centrally comes back to it's a two-way street. So as we get ready to dive into the meat of our discussion, we're going to kick it off with the mental health portion and professionals. And so I'd like to ask our first polling question to the group. So the question is, have you or anyone you know sought services at the Community Services Board? If you could answer that question, the answer, you could have either a yes or a no. And again, the polling questions are anonymous, so we don't know who's answering what. I'll give you a few more, about another half a minute. We're almost there. We have about 63% answered. You can also throw your answer in the chat, yes or no in the chat if you don't have the poll that came up. All right. We'll go ahead and share the results. So we have, it's about a little bit even for those who have actually sought services and those who have not. So that's going to help us to dive right in. We're going to start with Mr. Washington. Can you tell us a little bit about the CSB, the Community Services Board, and your role there and the services?
Sure, happy to do that. So the Community Services Board is the public agency that serves individuals with mental health issues, substance use disorder issues, as well as developmental disabilities in the county of Fairfax, as well as the two cities of Fairfax and Falls Church. We serve, right around 21,000 folks a year on average. And my role there is the executive director, which means that anything and all things sort of stop at my desk, but I could not get anything accomplished without my great team. We have around 1,000 full-time employees and another couple of hundred part-time employees, so it's a pretty big organization.
Okay. So yeah, so there's a lot of services that they provide. Can you kind of unpack some of those different services that a community, if I was to come to the CSB, what could I expect?
So I think one of the things that at least I think make a community services board great is we have a continuum of services. So right now, if you wanted to get an assessment, you could either, in the middle of the pandemic, get a teletherapy assessment if you wanted to, but also if you walked into our Merrifield Center in the central part of the county, you could get a face-to-face assessment Monday through Friday from 9 to 5. From there, you could, if you need outpatient services, we'll provide those to you. If you need case management services, we can provide that. If you need partial hospitalization or day treatment, we provide that. If you need peer services, people with lived experience where you think you'd be better to partner with those individuals, we do that. If you're in the middle of a crisis and if you need to go immediately to a safe place where you need 24-hour supervision, we provide crisis services. And even if you are in such a crisis where you feel like you really have to go to the hospital, we have clinicians that will partner and help you get into a hospitalization as well. And then, we also have a continuum of services to provide residential treatment for those individuals that are struggling with substance use issues. And then for the developmentally disabled population, we provide or contract with partners on a number of different services, whether it's support coordination services that help people get linked up with care, or whether it is employment and day services, or residential group home services, where we want to make sure people have a safe place to live that they can call their home, as long as that level of care is appropriate for them, and then also to be doing something meaningful and constructive during the day. So it really is a true continuum. We can never have enough prevention services. So I can't leave out the prevention team that we have that reaches and goes out into the community. One thing, kind of put a quick plug in there, is that if you want to learn more about mental health issues, and you can do this virtually right now as well, is we offer a course called Mental Health First Aid. It's really basically like a mental health one-on-one. It gives you an opportunity to learn a little bit about mental health issues, how to recognize them, and then also gives you some concrete things that you can do if you have come across someone or a family member that's having mental health issues on to intervene with that individual and provide support to them.
That's great that you gave a plethora of services that is provided by the CSB. And I don't know that a lot of people know that those services are available. So I'm glad that you put them out there. I'd like for us to ask another polling question to get a sense of our audience. The second polling question that we have in the mental health, could you put that up for me, please, Amanda? Have you considered seeking mental health services, but did not due to the lack of trust in the mental health treatment? See a lot of people weighing in. Give you about another 20 seconds here. And you can always put yes or no in the chat box if you can't see the polling question that's up. Okay, go ahead and end this. So we have a yes, there's about 21% has said yes, and we had another 79% that said no. So Mr. Washington, I'd like for you to, with that in mind, why do you think that we have so many people who don't seek mental health services?
So I could probably talk the rest of the night about that, but I'll try to keep it focused here. So, I think there's a number of different reasons, but to me, the largest reason really at the global level is stigma. Mm-hmm. Is that it's much easier for someone to go to the doctor's office and talk about having high blood pressure than it is to go to the doctor's office and talk about feeling suicidal or feeling depressed. And I think that is a long-term challenge that we've had in our society, and it continues. And I think with individuals, people of color and individuals with multiple backgrounds, that's only compounded. And I think it's compounded largely by just the history with the medical professional and the challenges that have occurred over the number of years. Mm-hmm. And I think to me, that's part of the hard work that all of us as mental health professionals and in the helping field have to find a way to work through and overcome.
Mm. Yeah, so you hit it on the head. I also would like for you to talk a little bit more about when, especially from the Black community, you go to the doctor and you don't see someone who looks like you. Do you think that that's part of the issue or concern?
I definitely see it as an issue of concern for sure. I think it's just naturally many times easier for people to talk and share things with people that have more things in common with them. And, a person that doesn't have the same ethnicity may have many other things in common with you, but typically when you walk into a professional's office and you have someone that's the same race or ethnicity of you, you automatically know there are going to be some commonalities as far as lifetime shared experiences. And some of those commonalities are things that you can talk about them verbally, but until you experience them, you really just don't get a feel for truly how deep those impact has on people's daily life.
Absolutely. So that brings us to the last polling question for mental health. If you could pull up the last question, please, so we can get some in. And if you have any questions that you would like to ask of Mr. Washington, please drop them into the chat box. Would having a mental health provider of the same race or ethnicity, ethnic background encourage your participation in mental health services? A lot of people weighing in. Give it about another 15 seconds. All right, go ahead and end the poll here. And so 84% say yes, and 16% said no. So I know that we don't have as many people of color in the mental health field. What would you say, or how would you encourage individuals who are seeking someone or trying to find someone in the mental health field of color? What would you tell them to do?
I would tell them to be diligent, don't settle. I think time and time again, what's been shown to be most helpful in the helping field here is someone that you can develop a relationship and a bond with. And often that's someone of the same color and ethnicity as you, but sometimes not. But to me, when you look over and over again, that's kind of at the core of the helping profession is, can you trust that individual? Can you develop that bond in relationship with that individual?
Yes, and that's a core point. Also, Chad just put in the chat box a link for therapists of color. So for anyone who is looking for mental health and you are seeking to find a professional of color, there is a link for that. And so you can go out there and, as Mr. Washington said, don't give up, be diligent. I know for on the federal side or for government workers, for our employee assistance program, you can ask specifically for individuals of color, and they will find you 3 links or 3 resources. So I would say also it's critical to go back and see what insurance you have available and find it through that route as well. So thank you so much for enlightening us on the professionals in mental health. I also would like for us to talk a little bit about how mental health plays a part in our physical health. And so that's going to move our discussion over to Dr. Lucas. So Dr. Lucas, can you first talk a little bit about what your services are, and then we'll launch a poll question.
Yeah. So I'm a board certified family physician with additional training in clinical informatics. So I work a lot with IT and systems infrastructure on that side of medicine, because a lot of what happens with your typical office visit, you may go in to see your doctor and they are so busy trying to click certain buttons in their chart to make sure that things are put in appropriately, that sometimes things may get missed in their interaction with you. So part of my job is making that piece more efficient so they can focus on the patient. So that is one thing that has been neglected, I think really over the last about 10 or 15 years. So hopefully you will see a swing back in the other direction, so the patient is at more of the forefront there. But I'm a primary care physician. I've been a physician now for about 12 years. I work primarily now in telemedicine. So I'm licensed actually in about 20 states right now. So I see people really all over the country. Where I'm moving my practice more so is going to be into patient advocacy. So to teach people how to access the resources where they are. Because as you've already alluded to, it's difficult sometimes for people to find a face that they trust, whether it looks like theirs, whether it doesn't. But really one of the things that we can do to help people get the services they need is to really educate them on the importance of going in to get what you need from that encounter. So no matter who is on the other side of that, if you understand the importance of like getting your blood pressure under control, making sure you get screened for diabetes, making sure your cholesterol is in check, making sure your mental health is where it needs to be, regardless of who's sitting across from you, because you've developed some skill set to know what you need to do to be successful in those encounters. I think that's important. because we have a finite number of people available to treat you right now. That's just the reality of where we are. Like I mentioned before, your doctors are really 20, 30 years in the making. So right now, what are school systems doing to make sure children are appropriately educated or getting the training that they need now so that they can proceed forward? So it's a really complicated picture as to how you increase those numbers, but really helping people take advantage of the services that are currently available wherever they may be to kind of get what they need out of it is something that I'm passionate about.
Yeah. So I see we had a question in the box, so I don't want to lose sight of that. So, and it has to, I think this is more on the mental health side, but I want to read it. It says, about family rights for patients of CSB. I have a brother who is currently admitted due to mental health issues, but it took him throwing himself out of a moving car to be admitted. Is there, I don't know if we could speak to that right now.
So that definitely sounds like a tragic and serious situation. And I think it sounds like a very unique and personal situation. So what I would say is that if you email me and give me your contact information, I will follow up or have someone from my executive leadership team follow up with you as quickly as possible. And so my email address is just my first name, Daryl, period, and then my last name at fairfaxcounty.gov. And if you go to the CSB website, my name is splattered with my email address all throughout there. So
Thank you for that. I just didn't want to lose sight of that, and I'm sorry for the disruption, Dr. Lucas.
Not at all, by all means.
So I wanted to go back to something that you said in your intro when you talked about your family member that they told them that they might as well go home and die when they went to seek care. And I know that I've heard stories along that same line. It just wasn't the same language. So a lot of times individuals don't feel like that the doctors that they're seeing are concerned about their issues. How can, because you said we really need to be our kind of like our own advocate and ask the right questions. What are some of the questions that you would recommend that anyone asks?
So, I want people to be prepared when you go into an encounter if you can. So if it's not an emergency setting, what are the questions that you have? Because sometimes you can get into the encounter and you want to bring something up and you're hoping, okay, well, maybe if I'm there, maybe the doctor will pick up on, maybe I'm having pain in this area, so I don't have to point it out. Like, doctors are not mind readers. Like, by all means, like, let me know what's going on with you so we can like look into it.
Mm-hmm.
And I think there is sometimes, depending on what you've experienced in the past, you tend to bring that with you into the encounter, good or bad. If you've had some negative experiences before, you may not be as forthcoming. And me, with my experiences, with my family, knowing what we've gone through, I may ask some more probing questions that maybe my colleague might not, even though they may be just as interested in your well-being.
Mm-hmm.
So I think not waiting for things to come to you, so to speak, but being more, I won't say demanding, but really knowing that your needs matter, your questions matter, your fears, your concerns are real, so they need to be brought to the forefront. So I don't ever want anyone to, I always say, I never want anybody to die from embarrassment. And that sounds like such a simple and possibly trite thing to say. But sometimes it's really what happens because you're on the cusp of getting it out, but you don't quite make that step. And sometimes if we're not probing deeply enough, we may kind of miss those. So I really want to empower people to be able to ask the questions that they have.
Great. So let's ask a question to our virtual audience. Can you pull up the next polling question, please? The first one for physical health. Do you believe that your doctor will make recommendations with your best interest in mind? Yes or no? You can also throw it in the chat if needed. And while you're continuing to fill out the poll, I just want to remind everybody that Daryl Washington did put his email address in the chat box if you need it. Okay, we'll give it about 5 more seconds and then we'll end this poll. I do see we have another question in the chat box, so I'll get to that in just a moment. All right, so a high percentage, 85% believe that their doctors will make recommendations with the best interest in mind. We still do have 15%, that's a high percentage that don't feel like they will.
Yeah, I was just about to say, I think people are being nice here. That's interesting. I didn't expect it to be quite that high, which is hopefully means you all have great relationships, with your physicians, which is wonderful. I never wanted to take that away from anyone, but at the same time, I really thought that was going to be possibly even reversed. So, but that's a good thing.
Yeah. So you said you thought people were being nice, and I think that saying that we need to not be so nice, because maybe that's why we don't get the services that we need or the attention to the issues that we have when we go in, because we're either embarrassed or we want to be nice and we don't want to be seen as a rebel rouser or a troublemaker.
Yeah. I had a really close friend a few years ago. He was, 39 going into 40, who was diagnosed with stage 4 lung cancer. I'm sorry, I have a lot of downer stories tonight. But during his basically last few months, when they would ask, is your pain under control? He would say yes, when I knew it was not. But he really wanted to let the clinical teams know that they were doing a good job, when actually they probably could have been doing a little bit more to get his pain under control. And I had to be an advocate for him to say, actually things are not going so well. So sometimes there's this desire to show that you are, a team player, you're not causing trouble. You don't want to lose this doctor who you've had for years, but then when you leave the appointment and go home and complain about the encounter, to your family members for years, and the question is, well, why don't you find another doctor? They're like, well, I can't leave them, which is an interesting concept, because I think we also know a lot of folks who seem to change doctors, like the seasons change, sometimes. So I think there should be some happy medium there, ideally, so I think if you're not getting what you need and you've given it a shot, then I'd say you may need to consider looking elsewhere. But at the same time, your questions need to get answered too.
Yeah, I think that maybe we was a little bit limiting on the yes or no, because some people said in the chat box that they wanted to say sometimes. So maybe that that it might not be all, it was either or, and maybe it would have been better to give them a middle option.
Yeah.
Well.
A lot of my answers in medicine are it depends. So that kind of sums it up there.
Yeah. So let me ask, because we are in the middle of the COVID pandemic, what are some of the most common myths in the Black community around COVID and doctors, so that you can dispel for us tonight?
One of the biggest ones from the beginning was, this isn't something that impacts Black people. That went on for a good while, and I think it did possibly some damage early on with having people approach it in a manner that was maybe a bit too relaxed. As we've clearly seen at this point, this is something that impacts everyone. And once we actually started pulling data, that stratify things by race and by location, we were able to see, oh my goodness, it seems to be affecting minority communities even harder. So it was a complete opposite, of what that myth had shown, from the beginning. So that really kind of put people behind the curve, so to speak, as to how they approached it. A lot of communities of color are also going to be your essential workers. So your bus drivers, people in food industry, or what have you. So they were being impacted even more heavily, and they weren't taking those necessary measures to help protect themselves. So that in particular was an issue. But what pandemics also tend to do is that they magnify greatly the problems that already exist. So systemic racism was already there. You had disparities in healthcare. You had people who weren't accessing services. The pandemic overlaid on top of that just magnified that. a hundredfold, if you will. So really what I hope it does is to place a spotlight on those things where we say, my goodness, we really can't go back to the way things were. I'm really hoping we never go back to the way things were done before, as a result of this. It is not an easy task, but I think really, I hope we learn something from this. And hopefully it doesn't take more people dying for us to realize that.
Yeah. And I think that's the thing that we wrestle with, because the myths that just kind of just take off and no one comes in and really helps us to unpack it. And so you're just going to tell, it's like that folk telling story. You tell the next person, then tell the next person, but nobody gets the ground truth. If we could pull up polling question number 3 under physical health, because I think that speaks to what we're talking about right now, Amanda. It's how often do you think that the healthcare system treats people unfairly based on their race or ethnicity? Because you just hit on something, Dr. Lucas, that it's disproportionate. So I'd like to see what the virtual audience thinks. Just as a reminder, if you are moving around, you might want to take your camera off. Just bring it down. We'll wait about another 10 seconds. And if you could publish it, the poll. All right. So very often, it's 61%, somewhat often, 37%, and 3% said not too often. So can you shed some light on that for us, Dr. Lucas?
Yeah, so this number I'm not surprised by, given the subject for the evening. So we have, a population that might be a bit more cognizant of that. So, and I think that would be appropriate. And what I'd like to at least encourage people to some extent, I think what you're starting to see now in some health institutions is really an awakening, in this area, as to how we are taught, certain things in medical school. I think just like you're talking about myths that people have about, COVID-19, there were some myths that were also spread in medical schools as students were taught, over the years as well. So in the past, when people were taught that Black people didn't feel pain, as much, as others, things of that nature. You have doctors who are in practice now who may be a bit older, that they may still have that line of thinking when you come in to get seen. I think you're seeing a lot of that being overturned. A lot of that is being looked at now, but it's still there. And really with the bias, that people may bring into the healthcare system, like we all have it, okay? I have my own biases, like you have yours, everyone has theirs, but like, what are we doing to take a look back to see, okay, well, am I keeping that in check? Did I bring it in and it's hindering the care that I'm delivering to someone? It's a continual process. So we don't just say, okay, we've arrived and we're here and we're no longer a bias. Like, that's just not the case. But I think it's something that we take seriously on a daily basis. But if you're feeling like you have someone that you can communicate with, someone that is seeing you, for who you are and kind of what you bring to the table, I think that's something that you can hold on to, no matter kind of what they look like sitting across from you. But it is something that is getting more attention now.
Yeah. So just having that awareness, and I think what you just hit on about in the education system, because in our previous session we talked about the education system and the needs to change the information that we're providing in the education system. So if that was an area that someone wanted to advocate for change of the information that's provided, what would you recommend?
So most of your healthcare systems, even your Fairfax County Health Department, they have usually community boards, that are set up where you can have some input there. And those are good places for people to get involved, because when I was a medical director at the Community Healthcare Center in Fairfax, those board meetings were sometimes lightly attended by people that looked like us, even though the services provided were for people that look like us, if that makes sense. Okay. So, you have to be, in these meetings, in your community meetings, whether it's city council, county commissioners, board of education meetings. If you have a few large healthcare systems in this area that have meetings that are open to the public, go in and show your face, make your name be known. Those are the sorts of places where you will have some impact. If you have, or if you're going to see a physician that is working with a student, always ask to see the student. I think that's sometimes a misconception where we say, well, I don't want the student working on me. I don't want the resident. That's a great time for you to sort of imprint and put your thumbprint on them. Some of my most poignant encounters that I had as a student were when I went in to talk to a patient, because you don't know what you're doing. You are learning at that point. But at that point, you are more so seeing the patient for who they are, because you're not in a rush to go from room to room. You're going to go back out and report to your physician or your attending physician, and you're going to have a second set of eyes on you. But that's a great way to sort of say to the student, hey, well, when my sister or cousin went through this, they experienced this. Don't ever do that to a patient again. So those are places where you can have some impact, where you can sort of help mold or shape those physicians as they kind of go through their training as well. So that's another plug for that.
Oh, that's very enlightening. I want to ask one final question, and this is Daryl and you, Dr. Lucas. Maybe you can talk about this together, as how the mental health impacts the physical health, and it shows up in the body.
Yeah, so for me, they are one and the same. So I always say, like, if your mental health, isn't in place, like I really can't do anything with you physically. If you are not in a place where you are ready to heal, like your body doesn't heal oftentimes. And that's that area of medicine that's a real gray area. I've seen it happen repeatedly. So people have come into the hospital. We've done everything that should work, on paper, but there is something else kind of holding them back in a different area. Until we really address that, things don't seem to get better because in their mind, things haven't changed. There hasn't been a shift there. So for me, they are one and the same. Sometimes things are a little lighter, maybe one way versus the other, but they're all interconnected. So I don't really see a difference there, but if things don't get addressed, then it's difficult to move the needle in either direction.
Yeah, and I'd like to second what Dr. Lucas said, is that I think that, our agency is at the CSB, we're making a huge push to make sure that the folks that we see have a primary care physician and also are going to get a physical with that primary care physician, because that's a huge thing. One of the things that is commonly said with our population is there's the what's called the deadly double, is the really huge link in between diabetes and depression. And that, if you have one of those, the other one is a real significant close association with that. And it's things like that where, if you improve the person's depression, then most likely their treatment and follow through with the healthy things for the diabetes is going to improve at the same time.
That's good stuff. And I don't always think that individuals understand the linkage between the two. And so that's why that they stay sick a lot longer, right? Because they don't understand the linkage. I got to be mentally ready, but I also got to be physically ready to heal. So thank you so much for that. So we're going to move to Captain Nichols. And I'd like for you to go ahead and just, if you could open up your mic and tell us a little bit about what you do as a part of the community, the Equity Board, and just enlighten us about that as initially.
Okay, I'm the equity lead for the department. And what we're working on right now, we're working on our equity impact plan, where we're looking at everything system-wide, all of our policies, our practices, and our procedures. And what we're trying to do right now, we're trying to introduce to our staff, at the rank and file from the chief through the professional staff person, as well as our volunteers. We're trying to have the difficult conversations about race and equity. And it is a great challenge, because I think looking at our demographics and the makeup of our department, I think when you talk about having a bias, just like we talk about in the mental health and the medical areas, when you talk about a bias, no one wants to be told that they have a bias. And we're trying to get everyone used to and get ready that we're going to have this difficult conversation about our biases. And everyone has a bias. And just because you have a bias doesn't make you a racist or a bad person. The biases that we have started with us when we were very young, and we brought them with us. And if we, sometimes we're led to believe that because I'm in law enforcement and I work with the community and I work with people, I don't have a bias, but that is completely false. So what we're also trying to do right now, we're trying to begin the process of training everybody in implicit bias and procedural justice and trust building. And that's going to help with legitimacy, because before we're able to get out and work with the community, we have to work on ourselves inside first.
Yeah, that's so true. And in the chat box, I see people putting things like trauma affects mental health and physical health, and minorities are traumatized often. And so the part that you talk about, the biases, that plays in as a part of the way that we're traumatized, if it's on a regular reoccurring basis. We know, because you just said about the bias especially in the Black community, and that you're training up individuals. So there's a move afoot to do that. But we also know that we still find the need to have to have a separate talk in the Black community with our family, our friends, and our children. I'd like to throw up a polling question really quick on this, and then I'm going to read off a comment there. But can you bring up the first polling question on law enforcement for me? Have you ever warned your children, your child, your children, or loved one to be careful when dealing with the police? You could throw the answer in the chat box as well if you don't have the capability to answer the polling question. We're close to 70%. We'll give about 10 more seconds. All right, gonna go ahead and publish the poll. So 92% and only 8% said no. 92% said yes, 8% said no. So from your perspective, from where you sit, is that surprising to you, Captain Nichols?
No, and when I saw that question, I thought about the conversations I had with my mother. I grew up in a single mother home, and I remember how I hated that conversation that my mother had with me over and over again when I sat down to eat, how I had to react and think about law enforcement. And I just couldn't understand why. Now, it was kind of different with my own daughters. I had that talk with from a different perspective, because having a law enforcement officer in the house meant something different to them. I would often ask them when they were in high school, I said, do you know the school resource officer? Yes. How do your friends react to the officer? How do you approach the officer? How do you feel about the officer? Just to see what we did in terms of raising them. But I remember that question coming up as a young person, and I hated that question. My mom would say to me, son, listen to me. You're very tall for a 12-year-old boy. When you do see the police, I know you may get nervous, and I had no idea why. She would say, don't run. And my experiences in life came about when I did have contact with a police officer. The first instinct was to run. I don't know why, but I wanted to run. But I had to reflect back on what she said to me. It is unfortunate that we have to do that and have that talk. I just sat on a panel about a month ago where I sat with and spoke with a group of 4th and 8th graders about the talk. And I remember teaching a program, a national program, when I did it in communities that were not Black and brown. Some of the kids thought I was speaking a foreign language because they were not aware of the talk and what it meant. So it is unfortunate, but it happens in the Black and brown communities.
Mhm. So, and knowing that it does happen, and we could see 92% is still happening in the Black and Brown communities, what what would you say could increase the trust, or how do you build that trust so that that's not a regularly occurring conversation?
Wow. How? I guess, I know the talk is right now to remove the school resource officers away from the schools. And in most cases, that's the only time a kid or child may have an opportunity to see and actually touch a police officer.
Mm.
I don't know if that opportunity will be there in the public setting to go up and have that conversation with a police officer because of the historical perspectives that are brought to that kid's psyche from their family members. So how that process happens, I don't know. But I think it starts with trust building. It starts with us getting out to the communities and engaging certain communities about, hey, here's what we do, and sitting down right next to them and allowing that opportunity for the community members as well as the young people in the community to sit next to us and ask us questions, to build that foundation and understand that we're not there to take them to jail. I used to hate that when I was a young officer working on the street, when I would hear a parent say to their child in a public setting, you better behave yourself, the police are going to take you to jail. And that's building that foundation for that psychological trauma that we're talking about and that distrust. If I do make a mistake, it's not going to be something where I'm going to engage a law enforcement officer and things are going to work out, but I'm going to go to jail. So it builds that swell of mistrust, and it's hard to break that once they become older and see certain experiences in life.
Mm. So knowing that that it starts at a very early age, I guess what I would ask is Mr. Washington to also weigh in on what kind of because I know that that's a mental weight that an individual, a child bears when you're constantly being told that the police are going to come and get you if you do something bad. What would you say to the parents or the guardians or anybody on this call who has influence over young children about how to really have a conversation that is um, more productive or moves towards attaining the behavior that you want to see in that individual, as opposed to using that already overarching concern about the police as another building factor for fear?
Sure. That's a challenging multi-layered question in many ways, because I think, the reality is that, like Officer Nichols was saying earlier, is that right now in our society, if you're African American, especially African American male, most parents, it's vital that you have the talk with them. So I think to candy coat the fact that the bias is not out there, that the differential treatment is not out there, I think diminishes the reality that is there. But I think once you have that conversation, I think you also have to balance that with the fact of not every police officer behaves in that way and thinks in that way, and that you have to find a way to interact safely and smartly with the police, but also not live your life in a way where you're constantly walking in fear. And that's much easier said than done. And I don't think it's a just sort of say it once and done type of thing. I think it's something that you have to build day after day after day, which is, vital for to have that individual relationship and the ability to be able to talk with someone on an ongoing basis, on a regular basis, to check in, to see how how they're feeling, and then help them navigate through these challenging things.
So I'm wondering if that's like something that we could still look at in the future. Maybe that's something that we need to revisit as a community on how to improve on that, on having not just the talk, but pairing it with, I think, better information for parents and caregivers to enable them to talk with their children about what the police role is along with all of the other programs that they're bringing to the table. Maybe that's something that we need to look at. I don't know. I'd like to also go ahead and put up the next polling question, please, for law enforcement. How much of the time do you think you can trust Fairfax County Police Department or the local police department to do what is right in the Black community? Just about always, most of the time, only some of the time, hardly ever, and then never are the options. We have about 50% of the vote. We'll wait for another, till at least we get to 70, we're almost there. At about another 15 seconds. All right, we can go ahead and end the poll. So most of the time is about 27%. Only some of the time is 39%, hardly ever 24%, 6% says never. So Captain Nichols, excuse me. Does that surprise you that that's what the virtual audience is experiencing or feels?
No, that doesn't surprise me. We have lots of work to do in law enforcement nationally and here in Fairfax County. Unfortunately, we recruit from all over the country. And when you bring persons from all over the country to an advanced county like Fairfax and an expanding urban county like Fairfax, we bring in all those biases and all those other life traumas with us. And we work with communities that sometimes we don't quite understand how to relate to those communities. And the conditioning that comes along with being a police officer, sometimes large numbers may mean you will be successful in your career. And sometimes we have caused damage and injuries to some of the Black and brown and even white communities where we get this pushback and blowback. So I'm not surprised by those numbers. We have lots of work to do. We're trying to do that at the very early stages in an officer's career. We're planning on right now with our police academy, with our new recruits, to take them to the African American Museum in the very beginning, and then train them on implicit bias, what it is and how to navigate around it, procedural justice and trust building. Then at the very end of the academy, have them go and practice that with persons within our most injured communities. And then hopefully we can build that reservoir and that foundation within them so they will have better reaction. So we can look at a number like this years down the line, and the numbers are at the very higher end, that we will respond and we will respect everybody's differences and provide them with the services they need as a person here or community member in Fairfax County.
Mm. So you said something that kind of jogged my memory on another topic. You said that you recruit from across the country to bring police officers in here. And so one of the discussions that I watched on television talked about if it would be helpful if the officers who police an area lived in that community, that they think that they would have better relationships with the community if they actually lived there. What are your thoughts around that?
I think in some aspects that's correct, but I think if you recruit, you have to look at community in a very different way. If you say the community is Prince William County, Fairfax County, mm-hmm. Montgomery County, Prince George's County, DC, that's the community. And if you bring in recruits from those areas, they're more likely to understand the dynamics and the demographics of Fairfax County and have a better reaction to the demographics we have here in Fairfax County. Mm-hmm. It is okay to recruit within Fairfax County too, but mm-hmm. I think we have to expand that and look at other surrounding counties, maybe in a 30 to 40 mile radius, to call it the community of Fairfax County.
Okay, thank you. So there's a couple of things in the chat that I wanted to go back to. There is a comment that says that the police officers in the school I taught was not nice. He was not building trust with the students. He walked around like a bully. So I think that for, and this is probably specific, but what are your thoughts around that?
Going back to what I said earlier, we have to do a better job of training the officers on what it really means to be a school resource officer. I think those things we talked about earlier, those biases, manifest themselves in explicit ways through arrests on things that probably is better handled by the school in an informal way, instead of introducing them to the criminal justice system, where now they have that record and how that's going to hurt them from applying to college, an apartment, a job, or house. So we have to retrain and reposition our officers to see it differently with our school kids. And I know, again, that the push is to take the school resource officers away from the school systems or the school system. But if we are going to leave them in the school system, we want to better train them on how they should react and leave that up to the schools instead of, unless it's something so violent that we have no choice, we have to start that process through the criminal justice service system.
I think it also goes back to how do we get involved with when there's a concern like that? How does the community get involved to address it?
Well, they can meet with the district commanders and say, hey, look, this is what's happening in this school. And we feel that the officer's not managing our kids the right way in the school system. We're looking at the numbers, and the numbers are showing that our kids are arrested. And you break it down by demographics. How do we change that narrative? How do we find the right officer for that school, the right empathy, the right understanding, and the right mentality to work within the school system to build relationships and to help the kids out and not put them in those care situations in terms of the criminal juvenile justice system.
That's helpful too. So it takes us to get involved as well.
It does.
So this is not one-sided. There's a long, let's see, I have a question about Fairfax County diversion program. How much equity is being implemented in the program? We all say that the last place we want a person who is mentally ill is to be in jail, but our criminal justice system is more than willing to put our Black and brown folks in jail regardless of the mental health. Sometimes the only choice a family member has is to involve the criminal justice system just so our family members can get help, the help that they need. Is there anything that you could add from your perspective, Mr. Washington or Captain Nichols?
Yeah, so I can actually speak to that from the diversion program. Really is a program that was started about 3.5, 4 years ago in Fairfax County, partnership between the CSB, the courts, police officers, the sheriff office, as a result of a young mentally ill lady getting tased inside the adult detention center. And what we're trying to do is divert individuals that have mental health issues, substance use issues away from incarceration and trying to get them the treatment and help. And I had this very question. So I actually had my data person run statistics at multiple, what we call intercept points where people touch our system. When we look at our emergency services, when we look at the number of folks that our mental health clinicians see inside the jail, to see if there are any disparities that are different from the population that we serve. And with the exception of one program, we didn't see any racial ethnic disparities that happen to go on. And with that one program, we're doing some targeted interventions to really take a strong look at that and see okay, why are individuals not referred to this specific program at the same rate as other individuals with different ethnicities with that. And I'm confident that within the next, half a year, we'll be able to correct that and make the changes, because I think everybody that's involved with that, sees that and wants to make those changes.
Thank you. Captain Nichols, did you have anything else to add to that?
A little bit. When we look at the year from the start from COVID until now, about 42% of our calls for service are with persons in need of mental health crises. And we've done a better job of tracking that from year to date. And we're training our officers. We have about 45% of our staff that are trained in crisis intervention training to actually look at it from a mental health standpoint instead of a enforcement standpoint. And right now we are doing a better job of training the officers to recognize what it is. And the average officer spends about a third of their time in terms of what they do managing mental health crises and triaging them to MCRC to get them the help they need instead of incarceration.
And that's helpful.
Yes,
So,
it is.
Is there anything else that you would like to add about the equity program that you're running right now?
It is a slow process. I want everyone to know that we are starting the process. We're going to, it is the law now through the House bills that we start this process in implicit bias training to look at why we are reacting to the community members in terms of arrest and use of force the way we do. It is going to take some time, but we're starting that process now. We hope to have that training up and running within the next 60 days. And it's going to take us a while to train the entire uniformed staff as well as the professional staff and the volunteers that are linked to the police department.
Okay. Thank you for that. So we're getting pretty close to the end of our segment tonight, but I'd like for each one of the panel members to really think about what is it that you want us to take away from our time this evening? What is the next steps that you would recommend for anyone who is looking to, number one, learn more about the programs that you run, and if they're wanting to do some work in the area, if they want to volunteer for something, what would you recommend to them? And while you're thinking about that, I want to ask our virtual audience to, number one, think about what you are already doing in the community. If it's something that we're not aware of, if you could throw that in there, and please make sure it's appropriate for the chat box. If it's something that you're doing for the community, put it in there so that we can actually capture that. And then if you have any last parting questions that are appropriate for the topic and the audience that we can ask to our panel members before we leave this segment. Let's see. My last question is, why are individuals made to take competency tests when facing a judge, when medical staff have diagnosed the convicted person and as having a serious mental health issue? Does it seem counterintuitive? I think maybe that's yours, Mr. Washington.
Sure. And hopefully I can get to sort of what the sort of question was here. So, you know, when we hospitalize someone in the state of Virginia, individuals have to be imminent risk to themselves or someone else. And there's several steps involved with that. There's an evaluation that my emergency service clinicians do to make sure they sort of meet the threshold where they are sort of deemed imminent risk. After that, we have an independent evaluator come in and do that evaluation. And then once that occurs, we can hold someone for up to 72 hours. And that within that 72 hours, everybody by law is entitled to a court hearing. And when you go before the court hearing, the evaluations are given on both sides, and there is a judge who's a special justice that makes the decision of, yes, this individual is so ill that they must remain in the hospital. The individual can choose to go into the hospital or stay in the hospital voluntarily. That's an option for them. And to me, the core of what this is really about civil liberties, to make sure that if there's someone where we're essentially taking away their civil liberties to be on the outside world and having to go to a psychiatric hospital, that we're not taking that lightly, and that we are making sure that individuals are being assessed and looked at very carefully before that very difficult and challenging decision is made.
Okay. Thank you. I just want to add that there's information in the chat box about the, oh goodness, it just slid up. The healthcare department, the health department officially has a COVID testing site, and the telephone number is in the chat box as well. Um, Martha says that the mental health first aid is a part of the training for the Sheriff's Academy. Our CSB via One Fairfax is looking at how we can look at engaging African Americans and Black males to be further engaged with being connected to primary care physicians. Dr. Lucas, did you have any other resources that you wanted to add when it comes to primary care physicians?
So I don't have them at this time. I'm actually in the middle of polling some physicians in the regional area. So hopefully I'll have a more comprehensive list to pass along to you.
Okay, all right. So we'll make sure that we'll have that available as well. I want us to take just a moment before our panel members give us their takeaways. And I want to ask individuals, what if you, especially if you've been with us for all three series, what are you going to do in the community? How are you going to challenge yourself to step up and make a change in our community? We've given out a lot of information, and we'll go over some additional resources before we close out. But I want to challenge you, or can you pledge to do something, take action in the community? If you could throw that in the chat, that would be helpful as well. There is, okay. So we're gonna just start, we're gonna kick it off with Mr. Washington. What's our takeaway from your discussion tonight?
Yeah, so for me, my takeaway is if you want to get engaged, there are several ways to do that. One is there's NAMI, National Association for Mental Illness, where you can go and you can find out more about mental health issues. That's one way. I've already put my plug in for mental health first aid. So you can go online and sign up for that. And we're doing those classes virtually in the middle of the pandemic. And then if you are a loved one is struggling with substance use issues, specifically with the opioid epidemic, and unfortunately, with the pandemic hitting us, we had for the last year and a half driven down the overdose rates, but it's spiked back up underneath of the pandemic. We offer training on how a layperson can administer Narcan or naloxone, which is a life-saving medication. And we will even offer that medication free for those that can't afford it. And you can take that training virtually as well. So those are kind of my two big plugs, if you will, tonight, as far as a takeaway and a walk away when it comes to, mental health and substance use issues.
Thank you. Oh, that's some great information. Dr. Lucas.
Well, there's a lot that I could say, but the thing that I really want to stress is communication. So I can't tell you how many times I've encountered people who have, access to services, and maybe they have a physician that they're seeing, and they leave that encounter saying, or coming back to tell me, like, can you believe this doctor told me A, B, C, and D? And after I listen to them, my response is usually, well, actually, A, B, C, D. And they're like, oh, well, it sounds different when you said it. So sometimes we need to be able to process the information or receive it, in a different way. And if we're not in the mindset of being in a place where we trust, the person sitting across from us, we can miss something, even if the information could have been accurate. So I'd say the main question, the main thing that I would point out is to really communicate, ask the questions that you have. If you're not clear about something, if you've received, let's say, a new diagnosis and you're uncertain about it, ask, what information can I read up on it? Can I look over this a bit more? If you've been prescribed a medication, ask about the side effects. If you're embarrassed, ask about the side effects. Still ask. So I can't stress that enough, because I really want people to be able to get what they need wherever they are. Because as much as I would like to say, well, everybody in the world come and see me at my office, that's just not practical. But at the same time, I want to make sure that your concerns, get answered. The other thing that I would point out too, we are coming up on, major holidays in our country. Holidays are typically a time where things can become a bit more raw. They get a bit more rough, so to speak, around this time, be it medical conditions, mental health, or what have you. And you've now overlaid a pandemic on top of this. And as I mentioned before, that just magnifies what was already there. So this is an even more critical time for you to seek out those resources. So if you imagine, people have been quarantined sometimes with a person who's been abusive to them, maybe the holidays would have been a time where they could get some reprieve from that, or maybe they were going to go into a situation where they're going to see it even more, see it even more, if you will. So I just say it's a time of more so where communication is needed. So if you need resources, you've already gotten quite a few today, reach out and tap into those because I never want someone to feel like they don't have anywhere to turn. So even though it can be difficult, sometimes you get connected with people that look like you, speak your same language, people you feel comfortable with, get the care that you need. Okay, you are worth it. And I want you to seek that out. So that would be my 2 cents.
Thank you. And Captain Nichols.
Yes, I want to start off by saying I do quite a few public speaking engagements. And one of the things that's disappointing to me is to go into different communities throughout Fairfax County. And before COVID, to sit in an audience and look at or listen to conversations about the police department, the numbers and use of force and incidents that occur in the communities. And I don't see people who are victims and witnesses of those crimes. And I want to say, if you can say anything or do anything, you have to get involved. You have to go to the meetings. You have to be plugged in to the district level to hear what the commanders are saying, to tell us how you want us to police and guard your communities. If you don't tell us that, then we do it based on data. And what we learn from data, yeah, there are hot spots, but there are also victims and witnesses there too that are going through trauma. So you have to engage at the meeting levels to tell us what you want and listen to what we're trying to do and just be responsive. And the other thing is you understand, and this is not an excuse, is that everything that we talked about tonight from Daryl and from Quentin, police officers are a cross draw from the community. One of the things I do here that we need your help is that we're trying to get within our own agencies, our psych therapists to look just like our population. We need therapists of color within the police department. I know we don't have that. We need that. And the last thing, if we have a misunderstanding as a police department and how we engage you, there's a process out there where you can file a grievance through our CRP, where if we don't give you the services that you think you need, reach out to CRP and have them look into the case. And we're going to try to be as fair and impartial as possible to get you the response that you need.
Yeah. One additional question is, you talked about the victims being present to have this conversation. Is there a virtual forum right now, since we are in COVID? Is there a virtual forum that your office has or the police department has where individuals can show up to voice their opinions?
We right now, if you go on the police department's webpage, the chief's webpage, we're meeting in every district station. They had a meeting last night in Fair Oaks, and I think in the coming days, actually maybe next week, they're going to be meeting at a different station. And you can go to those virtual platforms through Facebook Live and be part of that process and hear what they're saying, and then make yourself known and ask questions. So that's a way to get involved there.
Thank you. Okay, so I'm just going to read a couple of things out of the chat box right before we go to look at our resources that we have available. Someone says that the community of faith has a partnership with Fairfax County Neighborhood and Human Services. That's how they learned of this event. The CSB team via one Fairfax is looking. Oh, I already read that one. I apologize for that one. There is some additional documents on finding a primary care doctor that is available, and we will make sure that we take all of these links out of here and they will be included on the resources page that you receive, along with the survey that you will get tomorrow. That's going to take you only 5 minutes. So please take the survey because it helps us to know what we did good and where we need to improve, and then look at some of the things that we can do in 2021. Someone says, thank you, Dr. Lucas. And then can all the services links be emailed to the participants? The answer is yes. And then there's a lot of great comments in here. So again, the challenge is for each one of us on this call is to take an action, and hopefully you will do so. Now I'd just like to bring up the resources, and we'll just take a moment to go through a couple of those, as we usually just send them to you, but I think it's important for us to recognize what we have available. There's some general resources, the Fairfax County Health and Human Services Assistance from a Distance. There's also the Giving Parents the Right Tools, African American Parenting Classes, and Dad Parenting Classes. These will all be live links that you can click on. If you want to know more about the Fairfax County Board and Authority Commissions, if you're looking at becoming an advocate or doing some work with those, you can click and find out more information, how to contact individuals and get involved that way. Reporting child abuse in Fairfax County. If there is a need, you have the right contact information. As Dr. Lucas said, domestic violence goes up around this time of year. So there's the domestic and sexual violence resources in Fairfax County link, and then virtual centers for active adults or our aging population. Along with that is the mental health services, is finding a private therapist of color. There's the printable fact sheet about the Fairfax Falls Church Community Services Board. They also have, and as Mr. Washington talked about, all of these services that they have available for mental health, substance use disorder, and developmental disabilities. You can print the card. And then also the National Alliance on mental illness. And then the Truth About ACEs, or Adverse Childhood Experiences. So there is a plethora of information. I know it takes a while to unpack some of this, but it is worth the time. The medical services, why do I need a primary care doctor and how do I find one? Guidelines for safe and relaxing Thanksgiving during COVID. We already know that in the DMV area that the numbers have spiked up again, and that they're saying that you should not be having dinner, Thanksgiving dinner or gatherings, unless it's with the people in your house. Please follow the guidelines. And then the Fairfax County Health Department resources and contact, and then where you can go for COVID testing. And also from the public safety is the police data and reform update, and the police civilian review panel. There's been a lot of information that's put out throughout this 3-part series. I just want to thank our panel members again for spending time with us and providing such a great amount of information. I also want to say thank you tonight. Hopefully that this series has been useful to you, which was presented by the Fairfax County agencies, the Neighborhood and Community Services, the Health Department, Department of Family Services, and Fairfax Falls Church Community Services Board, in partnership with the Fairfax County Public School and the Northern Virginia chapter of the National Coalition of 100 Black Women. We thank you for your participation, and we look forward to hearing from you on the surveys. Take care and good night. If the panel members can stay on, it would be helpful.